Hi, Daktari, my head is aching. Yani, hii kichwa imekuwa ikiniuma for the last 3 days. I don't know what's wrong. I have bought medications from the chemist. Nothing seems to work, Daktari. I've had headache before, but not this kind. I can't sleep. I can't read. I am straining. Kwanza sahi naisikilia tu hapa katikati tu kabisa, Daktari. That is exactly penye naisikilia, and it's exactly where I feel that much intense pain. So hiyo ndio imenileta. I'm just hoping to get a solution, Daktari, because where I can barely go to work. So please help me out in this. Oh, so you say you've had headache for the last 3 days. Does it only ache at the center point of your head, or are there times it aches at the front, the sideways, the back? Are there times that it's worse than other times, maybe daytime or nighttime, times when it's actually very severe than other times? On a scale of 1 to 10, how bad would you say this headache is? 10 being the worst pain you've ever felt, and 1 being the least pain that you've ever felt. Do you have any drugs that you're currently using? Do you have any chronic conditions, hypertension or diabetes? Are there people in your family who could be having this condition, diabetes and hypertension? And what are the other associated symptoms? Do you have headache, nausea, vomiting, diarrhea, chest pains, feeling like your heart is just beating faster than it normally does? Do you have any flu? Are there any other pains in your body? Did you fall or hit your head with something? Do you have a problem with your eyesight? Is this the first time that you've actually had this kind of an intense pain, or does it come and go depending with different seasons or different occasions? Do you know any triggers to this headache? How about your menses? Are there any changes? Are they heavier than normal, or are you going for longer days on your menses than normal? How about your sexual life? When was the last time you were sexually intimate? How many partners have you had? Do you have any issues in that area? Do you have any pain? Excuse me? Are all those questions necessary? Well, let's get into why doctors ask so many questions. Hello, Daktari explains here, keeping it as basic as possible. Cynthia Jogu are my names, and I'm a medical doctor by profession. What you just watched was a simple illustration of a patient coming in with something as simple as headache, but they're asked all these questions by their doctor. And what is Daktari explaining today? Why doctors ask so many questions. Yes, because it's high time we bridge that knowledge gap to make it easier for you, the patient, to answer. I'm passionate doing this particular video because I have seen situations where patients intentionally give false information or conceal information that is hide, or they are very minimalistic to giving answers to the doctors or to the healthcare provider who's with them. And unfortunately, this occurs because of lack of an understanding of why does this doctor need this information from me? What is the relevance? What is the connection between what has brought me and what I'm being asked? And that is the essence of me sitting here today in this platform as we get to break that down. Today we are looking at 5 reasons why doctors ask so many questions. Now, 1, to guide the discussion or to guide the session. So when dealing with females and in the pediatric section where it's a parent who's brought in the child, I have seen that in this particular group of people, information is actually what they just want to give. They just want the doctor to know everything, what is relevant, what is irrelevant. They're just willing to say it all. However, Remember, there is time as a factor. There are other patients outside waiting, or there are other appointments that the doctor has to attend to in that particular day. So doctors will ask you particular questions because they want to troubleshoot straight to the problem, pick what is relevant, and keep off that which may not be of assistance in that particular situations, as compared to the male gender. For them, it's interesting because they just want to say exactly what has brought them, and they're like, this is my issue, fix me, Daktari. But unfortunately, there is so much that is left underneath, and it could be resulting to whatever manifestation that they've actually presented with. So the doctor has to ask them this question to derive the information from them. So doctors have to ask these questions. They may look many and they may look haphazard, as we've seen in that particular illustration, but these questions are actually very structured. It's what we call history taking or clerkship from our end. And the main goal, as we're tackling point 1, is to not get too much that is irrelevant and not get too little and miss out on what is relevant. On to the second point is to know the cause. Every disease has a cause, and if given in that instance of headache, you could be having a headache which is a primary headache. Actually, most people just come and say, Daktari, I have migraines and all that. A primary headache simply means it's purely a headache, and it's actually a diagnosis of exclusion, meaning everything else has been ruled out. Everything else is okay, it's just the headache. But in more cases, you actually realize this headache is not that. It's a symptom of an underlying disease. And the doctor has to ask you all these questions to get to the root cause of what is it that could be causing that particular headache. So the cause is really important. The third point is severity. Every condition has a severity. Given, for example, pain at any part of the body, this helps the doctor to know how bad is this pain. We often use a scale of 1 to 10. Sometimes it's pictures if you're dealing with children and all that. Just to know how bad is this pain, because it determines which medication, the stronger medications or the mild or less strong medication. In an instance like cesarean section, the nature of the condition and the severity, a woman will come who needs cesarean section. Reason is because she's had previous cesarean section, but she is fine, the baby inside is fine. So this calls for an elective where she gets to be told the particular date, she goes home, prepares, plans, thinks through, gets to think through. That is, she has the privilege of time and come on that particular date, as compared to a lady who just came and for a reason or another, she gets what we call obstructed labor. We look at these things in the course of time. So what does this mean? It means that she's tried to push out the baby, and for some reason this baby cannot come out despite other formulas being sought, and she has to go straight for an emergency cesarean section. So that is why the severity of every condition has to be assessed. The fourth point is to see you as a whole. Now, this is very important because you could be having one condition that you're aware of or that has brought you, but you're a whole human being. The doctor needs to know, after this, do you need services from other healthcare providers, not only that particular doctor? It could be that you're having a lot of stress, you're going through stress in your life, and the doctor will give you the pain medications for that head, but refer you to a psychologist or refer you to a nutritionist if you're having conditions like diabetes and all that, for diet modification and all that. So the doctor, by asking you so many questions, they're able to see you holistically and also take care of you holistically, not just in the dimension you approach them from. And finally is appropriate management, which I think I've alluded to the entire time. Right management means the doctor, having analyzed you, first of all, these questions are aimed at getting the proper diagnosis. History is one of the main aspects of healthcare that allows us to get a diagnosis, such that if the doctor is going to send you for further tests, laboratory imaging and all that, it's just a confirmation, but they already have a clear picture of what they're actually dealing with. So once they have the right diagnosis, it results in the right management. Is it surgery? Is it just medications that you need? If it's diabetes, is it an insulin case or tablets will do? Is it, and all these factors result to what we've covered in our previous video. The right information resulting to the right diagnosis, result to the proper channeling of resources, and better outcomes. So let's be more receptive to the questions. Let's be easy to respond to the question and respond as truthfully as possible. Confidentiality is one of the pillars in medicine, and it's not broken unless otherwise stated, which is also not so common. So no doctor is just going to go and tell out your story. Be responsive. Don't feel bombarded. Actually, the better you can give those goal-oriented answers, the better and easier for you and your healthcare provider. That is all for today. Let me know the impact of these videos. If we are making your journey easier, be sure to subscribe and to like and to hit that notification bell. Be sure to follow me on my Facebook page, Daktari Explains, as we continue to interact more and more. That's all for today. I wish you a beautiful time from wherever it is you're watching me from. Goodbye.